Signs and symptoms of irritable bowel syndrome. Irritable bowel syndrome affects 6 to 18% of people worldwide. This condition involves changes in frequency of bowel movements and lower abdominal pain. Diet, stress, poor sleep, and changes in gut bacteria may all trigger symptoms. However, triggers are different for each person, making it difficult to name specific foods or stressors that everyone with the disorder should avoid. The most common symptoms of irritable bowel syndrome and what to do if you suspect you have it. Number 1. Pain and cramping. Abdominal pain is the most common symptom and a key factor in diagnosis. Normally, your gut and brain work together to control digestion. This happens via hormones, nerves, and signals released by the good bacteria that live in your gut. In irritable bowel syndrome, these cooperative signals become distorted, leading to uncoordinated and painful tension in the muscles of the digestive tract. This pain usually occurs in the lower abdomen or the entire abdomen, but is less likely to be in the upper abdomen alone. Pain typically decreases following a bowel movement. Diet modifications such as FOD, MAPS, these are short chain carbohydrates that are poorly absorbed in the small intestine and are prone to absorb water and ferment in the colon, may improve pain and other symptoms. Other treatments include bowel relaxants like peppermint oil, cognitive behavior therapy, and hypnotherapy. For pain that does not respond to these changes, you need to consult your gastroenterologist. Number 2. Diarrhea. Diarrhea-related irritable bowel syndrome affects roughly one-third of patients. Studies have shown that people with diarrhea predominant irritable bowel syndrome had more than twice bowel movements per week than those without irritable bowel syndrome. Accelerated bowel transit in irritable bowel syndrome can also result in a sudden, immediate urge to have a bowel movement. Some patients describe this as a significant source of stress. Additionally, stool in the diarrhea predominant type tends to be loose and watery and may contain mucus. Number 3. Constipation. Constipation predominant irritable bowel syndrome is the most common type, affecting nearly 50% of people with irritable bowel syndrome. Altered communication between the brain and the bowel may speed up or slow down the normal transit time of stool. When transit time slows, the bowel absorbs more water from stool and it becomes more difficult to pass. Constipation is defined as having fewer than 3 bowel movements per week. Functional constipation describes chronic constipation that is generally not painful. In contrast, constipation in irritable bowel syndrome includes abdominal pain that eases with bowel movements. Constipation in irritable bowel syndrome also often causes a sensation of an incomplete bowel movement that leads to unnecessary straining. Along with usual treatments for irritable bowel syndrome, exercise, drinking more water, eating soluble fiber, taking probiotics, and our limited use of laxatives may help. Number 4. Alternating constipation and diarrhea. Mixed or alternating constipation and diarrhea affects about 20% of patients with irritable bowel syndrome. Diarrhea and constipation in irritable bowel syndrome involve chronic, recurring abdominal pain, which is not related to diet or common mild infections. This type of irritable bowel syndrome tends to be more severe than the other with more frequent and intense symptoms. The symptoms of mixed irritable bowel syndrome requires an individualized treatment approach rather than one fits for all recommendations. Number 5. Changes in bowel movements. Slow moving stool in the intestine often becomes dehydrated and creates usually hard stool, which can exacerbate symptoms of constipation. Prompt movement of stool through the intestine leaves little time for absorption of water and results in loose stool characteristics of diarrhea. Irritable bowel syndrome also causes mucus to accumulate in stool, which is not usually associated with other causes of constipation. Blood in stool may be a sign of another potentially serious medical condition. Blood in stool may appear red but often appears very dark or black with stray consistency. 6. Gas and bloating. Altered digestion in irritable bowel syndrome leads to more gas production in the gut. This can cause bloating, which is uncomfortable. Bloating and cramping are more common in women and in constipation predominant irritable bowel syndrome. Avoiding lactose can help reduce bloating. Food intolerance. Up to 70% of individuals with irritable bowel syndrome report that particular foods trigger symptoms. Some common ones include gas producing foods, lactose and gluten. Fatigue and difficulty sleeping. Over half of people with irritable bowel syndrome report fatigue. Having low stamina, that limited physical exertion in work, leisure and social interactions. Irritable bowel syndrome is also related to insomnia, which includes difficulty in falling asleep, waking frequently and feeling unrested in the morning. Studies have shown that those with irritable bowel syndrome slept about an hour longer, yet felt less refreshed in the morning than those without irritable bowel syndrome. Interestingly, poor sleep predicts more severe gastrointestinal symptoms the following day. Anxiety and depression. Irritable bowel syndrome is linked to anxiety and depression as well. Anxiety and digestive irritable bowel syndrome symptoms reinforce one another in a vicious cycle. People with irritable bowel syndrome experienced greater changes in stress hormone cortisol, suggesting greater stress levels. Anxiety reduction therapy reduces stress and irritable bowel syndromes. What to do if you think you have irritable bowel syndrome? If you have symptoms of irritable bowel syndrome that interferes with your quality of life, visit a primary care doctor near you. Irritable bowel syndrome is diagnosed by recurrent abdominal pain combined with weekly pain as well as some combination of pain relieved by bowel movements and changes in frequency of bowel movements. Lifestyle changes, stress relief, exercise, drinking plenty of water and over-the-counter laxatives can also help. Probiotic supplements may also reduce symptoms. Additionally, avoiding digestive stimulants such as caffeine, alcohol, sugary beverages can reduce symptoms in some people. If you think you have irritable bowel syndrome, consider keeping a journal of food and symptoms, then take this information to your doctor to help diagnose and control the condition.